Good morning, everyone. So today I'll be talking about elder abuse and dementia in South Africa, and I'll be presenting on the initial findings of a situational analysis that we performed on the status of care and support for older adults in South Africa. And these are my co-authors. Just a little bit of background. Elder abuse is a hidden problem due to underreporting globally. The World Health Organization basically estimates that only 4% of cases are actually reported. 1 in 6 persons aged 60 years and over have experienced some form of abuse, and it's also estimated that 2 out of 3 persons living with dementia have also experienced some form of abuse. South Africa has no national prevalence data on elder abuse or on dementia currently. There are a few localized studies, but very few. But these studies in South Africa suggest that the rates are high, and they identify women and persons with dementia as being high-risk groups. So the purpose of the study was to examine the provision of care and support for older persons with dementia and their families in South Africa. And we did this through a review of the current status of care and support available to this particular group, to these groups, and to determine whether these provisions are supporting vulnerabilities to elder abuse. So just a quick glance at the methodology. This project is nested within the STRIDE project, which was mentioned earlier by Margie as well. And STRIDE stands for Strengthening Responses to Dementia in Developing Countries. South Africa is one of 6 other countries that's currently participating in this. And for the purpose of this presentation, we'll be presenting on the phase 1 desk review results, situated within the situational analysis work package. This is following the STRIDE's topic guide, which covered about 15 topic areas. It's quite an extensive piece of work, and it also included the WHO's global dementia indicators, and also performed a SWOT analysis that Margie spoke to earlier in detail, looking at the strengths, weaknesses, opportunities, and threats of the South African system currently. This will be followed up at a later stage with stakeholder interviews with persons living with dementia, their carers, government stakeholders, and NGOs. So in short, the findings, we found that the socioeconomic factors such as widespread poverty, inequality, unemployment in South Africa is increasing household dependence on older persons. Very often the individual's, older person's pension is the only source of income within the household, which kind of opens them up to more exploitation and vulnerability. Financial exploitation in that sense. Also, the presence of stigma and misconceptions about dementia or not understanding dementia has often led to social isolation or rejection of the individual as well as the family, and also violence enacted against the stigmatized. It was also spoken about earlier on by our previous speakers is a dementia invisible policy environment. Currently, South Africa has very good policies, but they have no national dementia health plan at the moment, and some significant challenges with obtaining a universal health coverage in South Africa. Currently, a fragile and fragmented health system, which is characterized by a lack of understanding and knowledge about dementia care and support, low morale and staff shortages amongst healthcare workers, overburdened system, fragmented diagnostic systems, poor referral systems, and discontinuity of care. And also, Margie spoke to the long-term care system in South Africa based on the work that is done there, but it's pockets of care that's available in South Africa, where it's largely inaccessible to most South Africans who can't afford expensive private care. The resources available in public sector is largely inadequate. There's only about 8 registered facilities across the country, and the demand is much greater than the actual need. All these factors create this imbalance of power between the system and the service user, and fuels known risk factors of elder abuse that we know that literature tells us is, for example, stress, caregiver burden, lack of support, lack of knowledge of how to care for someone with dementia, and relationship strain within families. This increases vulnerability to elder abuse. This, of course, being exacerbated by COVID-19 challenges, exacerbating risk and vulnerability with a lack of prioritization on the needs of older persons. So basically in South Africa, currently we do not have the evidence to actually mobilize resources to strengthen integrated dementia care provisions. So what we need to understand what the landscape of elder abuse is in South Africa, and particularly with a focus on persons living with dementia, in order for us to respond adequately. So there needs to be a focus on some measurement and how to measure elder abuse in South Africa in this particular context, using our theories, using that is based and owned in Africa, and providing an evidence base, starting with prevalence and routine monitoring. So basically, in essence, our task is to start this process by examining what the situation is, generating the evidence base that is needed to mobilize resources, and then we map this response that promotes dignity, safety, and well-being, that it's inclusive of older persons living with dementia and their families. Thank you. Now I'll hand over to the chair now.
Thank you very much, Roxanne. Another very important and understudied issue, I think, I don't know about in Africa. One question, I think that you have a great proposal in terms of next steps to really build the evidence on the topic, but shorter term, given the importance of the messages that you've identified, do you have a plan to try and transfer these key messages to policymakers locally or communities locally right away to increase awareness?
Well, it's a huge task, it's a huge undertaking. Yeah. And basically for policymakers to have the tools and the resources to make these kind of decisions that is needed, you need the evidence base. So the first step, and this is part of what we're doing with the project, with STRIDE and with the PhD, is to generate the evidence to mobilize that. So part of what we're doing is to identify proper tools for measurement and how to screen for elder abuse for older persons and from the caregiver's perspective. And also we're planning to do a household survey next year, permitted, depending on what's happening with the COVID situation, to actually establish what is the prevalence of persons living with dementia in South Africa and how many of those are affected by abuse. So it's about filling that gap and mobilizing all the information we're collecting through the STRIDE project to move and engage policy stakeholders to develop a national dementia plan, whether that's a standalone plan or whether that will be integrated or absorbed by existing policies to optimize current resources. That will be the outcome of the big project. So yeah, we're working towards it. We won't be able to solve all the problems and answer all the questions, but at least we're starting with answering some of the big questions initially.
You clearly have a very important agenda and very difficult questions to ask in your research. So I wish everybody very good luck for this.